I'm about to reveal something that could save your life starting tonight. What I'm going to share will completely change how you think about your heart rate. And it might shock you because everything you've been told by mainstream medicine about normal heart rate ranges for seniors is dangerously outdated and could be putting you at serious risk right now. If you're dealing with a resting heart rate that seems higher than it used to be, that fluctuates wildly throughout the day, that spikes when you stand up or climb stairs, that feels irregular or skips beats occasionally, that leaves you feeling breathless or dizzy during normal activities, then what I'm about to tell you is critically important. Your heart rate isn't just a number on a fitness tracker or a reading your doctor glances at during annual checkups. It's your body's most reliable warning system, and when that system starts sending alarm signals through abnormal heart rate patterns, ignoring those signals or accepting generic age-related explanations could be the difference between preventing a cardiac event and experiencing one. Here's what's dangerous. Most doctors still tell seniors that a resting heart rate between 60 and 100 beats per minute is normal. That's a massive 40-beat range that treats a 65-year-old marathon runner the same as a 75-year-old with uncontrolled diabetes. This outdated guideline misses critical warning signs. Your heart rate reveals whether your cardiovascular system is compensating for hidden problems, whether medications are affecting your cardiac function, whether your autonomic nervous system is breaking down, and whether you're at immediate risk for sudden cardiac events that most seniors never see coming until it's too late. I'm Dr. Claire Whitmore, and after 20 years as a cardiac surgeon and cardiologist, I've treated thousands of seniors whose first symptom of serious heart disease was a heart rate pattern their primary care doctor dismissed as normal aging. I've diagnosed heart failure from resting heart rates that stayed consistently above 85. I've identified medication toxicity from heart rates that dropped into the low 50s. I've prevented strokes by catching atrial fibrillation early through irregular pulse patterns. And I've taught thousands of seniors the exact heart rate monitoring protocols I'm about to share with you that identify problems months or even years before they become medical emergencies. What I'm going to give you in this video is worth more than what most cardiologists charge for comprehensive cardiac evaluations. You're getting a complete diagnostic framework to identify what your specific heart rate pattern reveals about your cardiovascular health. You're getting the exact optimal heart rate ranges for different types of seniors based on your fitness level, medications, and existing conditions. You're getting the insider information about how common medications affect heart rate that your doctor never explained. You're getting the warning signs that mean you need emergency medical attention tonight, not next week. And you're getting the specific interventions to optimize your heart rate naturally, reduce your cardiac risk, and add years to your life. Stay with me through every minute because missing one piece of this information could mean the difference between catching a problem early when it's easily fixable and discovering it too late when you're in the emergency room facing emergency surgery or permanent damage. This isn't theory. This is practical, life-saving information that you can implement today and see measurable improvements in your cardiovascular health within weeks. Let me start by telling you about 5 different heart rate categories for seniors, because understanding which category you fall into determines everything about your treatment approach, your risk level, and your intervention strategy. Category 1, the optimal athletic senior heart rate, 55 to 65 beats per minute. The first category is what I call the optimal athletic senior heart rate, which ranges from 55 to 65 beats per minute at rest. This is the gold standard heart rate range that indicates exceptional cardiovascular conditioning and efficient cardiac function. If your resting heart rate consistently sits in this range, if you've maintained regular cardiovascular exercise throughout your adult life, if you have no history of heart disease or cardiovascular medications, and if you feel energetic and experience no dizziness or fatigue, then you have achieved what only about 15% of seniors ever accomplish. Your heart is pumping efficiently enough that it doesn't need to beat as frequently to deliver adequate blood flow and oxygen to your tissues. Here's the mechanism. When you maintain consistent aerobic exercise over years and decades, your heart muscle strengthens and enlarges slightly. Each contraction pumps more blood per beat, a measurement called stroke volume. Higher stroke volume means your heart can deliver the same amount of blood and oxygen with fewer beats. This is why elite athletes often have resting heart rates in the 40s or low 50s. For seniors, a resting heart rate in the 55 to 65 range indicates you've maintained enough cardiovascular fitness that your heart operates with athletic efficiency, despite the normal aging changes affecting cardiac tissue. The intervention protocol for this category is simple. Maintain what you're doing. Continue your regular cardiovascular exercise program of at least 150 minutes per week of moderate intensity activity. This could include brisk walking, swimming, cycling, dancing, or any activity that elevates your heart rate to 50 to 70% of your maximum. Monitor your heart rate weekly using a reliable device to ensure it remains stable in this optimal range. Stay hydrated with 8 to 10 glasses of water daily because dehydration can artificially elevate resting heart rate. Manage stress through meditation, deep breathing exercises, or yoga because chronic stress hormones can gradually increase baseline heart rate even in fit individuals. Here's the critical warning for this category. If your heart rate suddenly drops below 50 beats per minute, especially if you experience dizziness, fainting, confusion, or extreme fatigue, you need immediate medical evaluation. This could indicate progression to symptomatic bradycardia requiring pacemaker intervention. Even athletic seniors can develop electrical conduction problems that require medical treatment. Do not assume that a very low heart rate is always healthy just because you're fit. Category 2. The healthy baseline senior heart rate, 65 to 75 beats per minute. The second category represents the healthy baseline senior heart rate, ranging from 65 to 75 beats per minute at rest. This is the ideal target range for most seniors who maintain reasonable fitness levels and manage their health conditions effectively. If your resting heart rate consistently falls in this range, if you engage in moderate physical activity at least 3 times per week, if your blood pressure and cholesterol are controlled, and if you have no symptoms of chest pain, shortness of breath, or excessive fatigue, then your cardiovascular system is functioning exactly as it should for your age. The mechanism behind this range involves normal, age-related changes in cardiac tissue combined with adequate fitness maintenance. As you age, your heart muscle experiences some natural stiffening, your maximum heart rate decreases, and your cardiac electrical system may slow slightly. However, when you maintain regular physical activity and manage cardiovascular risk factors, your heart compensates for these changes efficiently. A resting heart rate in the 65 to 75 range indicates your heart is working neither too hard nor too easily. It's the cardiovascular equivalent of a well-maintained engine running at optimal efficiency. The intervention protocol focuses on maintaining this healthy baseline. Continue regular cardiovascular exercise with a goal of 150 minutes per week of moderate activity or 75 minutes of vigorous activity. Incorporate strength training twice weekly because muscle mass directly affects cardiovascular efficiency. Maintain a heart-healthy diet emphasizing vegetables, fruits, whole grains, lean proteins, and healthy fats while limiting sodium to 1,500 to 2,000 milligrams daily. Monitor your heart rate monthly and track any trends upward or downward over time. Manage stress actively because chronic stress can gradually shift your baseline heart rate higher over months and years. The specific supplement recommendation for maintaining this category is coenzyme Q10. Multiple studies show CoQ10 supports optimal cardiac function and energy production in heart muscle cells. The dose you need is 100 to 200 milligrams daily of ubiquinol form, which is the active version your body can use immediately. The brand I recommend is Cunol Ultra CoQ10, which uses a patented formulation for superior absorption. Take it with a meal containing fat because CoQ10 is fat-soluble. Most people notice improved energy levels within 4 to 6 weeks, though the cardiac benefits build over several months of consistent use. Here's the warning. If your resting heart rate begins creeping consistently above 75, despite maintaining your normal activity level and stress management, schedule a comprehensive cardiovascular evaluation. This gradual upward trend often indicates developing problems like early heart failure, thyroid dysfunction, or inadequate blood pressure control before symptoms become obvious. Category 3. The borderline concerning senior heart rate, 75 to 85 beats per minute. Category 3 is what I call the borderline concerning range, from 75 to 85 beats per minute at rest. This range sits in a gray zone where your heart isn't in immediate danger, but it's working harder than optimal and signaling that something needs attention. If your resting heart rate consistently measures in this range, if you notice it's gradually increased over the past year or two, if you've reduced your physical activity level, if you've gained weight, or if you're managing multiple chronic conditions like diabetes or high blood pressure, then your heart is compensating for increased demands or decreased efficiency. This is your body's early warning system telling you that intervention now can prevent progression to more serious cardiac problems. The mechanism involves your heart increasing its rate to maintain adequate blood flow when cardiac efficiency decreases. This can happen through multiple pathways. Deconditioning from reduced physical activity causes your stroke volume to decrease, forcing your heart to beat more frequently to pump the same amount of blood. Excess body weight requires your heart to perfuse more tissue, increasing cardiac workload. Uncontrolled blood pressure forces your heart to pump against higher resistance. Chronic stress hormones from anxiety, poor sleep, or life circumstances keep your sympathetic nervous system activated, driving heart rate higher. Certain medications, including decongestants, bronchodilators, and some antidepressants, can elevate baseline heart rate as a side effect. The intervention protocol for this category requires active effort to shift your heart rate back toward the healthy baseline range. Initiate a structured cardiovascular exercise program starting with 20 minutes of moderate activity 3 times weekly, gradually increasing to 40 minutes 5 times weekly over 8 weeks. This gradual progression prevents overexertion while allowing your cardiovascular system to adapt. Focus on weight reduction if you're carrying excess pounds, because every 10 pounds of weight loss typically reduces resting heart rate by 2 to 3 beats per minute. Review all your medications with your physician to identify any that might be contributing to elevated heart rate. Consider alternatives that don't affect cardiac rate if medically appropriate. The specific supplement protocol for this category includes magnesium glycinate, 400 milligrams, daily taken before bed. Magnesium plays a critical role in cardiac electrical stability and muscle relaxation. Many seniors are marginally deficient in magnesium, which can contribute to elevated resting heart rate and palpitations. The glycinate form is highly absorbable and doesn't cause digestive upset like cheaper magnesium oxide. The brand I recommend is Doctor's Best High Absorption Magnesium. Take it consistently for at least 8 weeks because magnesium tissue levels build gradually. Most people notice their resting heart rate decreases by 3 to 5 beats per minute within 2 months. Let me give you a diagnostic test you can do right now. Sit quietly for 5 minutes, then take your pulse for a full 60 seconds. Write down the number. Now stand up quickly and immediately take your pulse again for 60 seconds. If your heart rate increases by more than 20 beats per minute when you stand, this is called excessive orthostatic tachycardia and indicates your autonomic nervous system isn't regulating your cardiovascular response properly. This is common in seniors with borderline elevated resting heart rates and suggests you need more aggressive intervention to improve cardiovascular conditioning. Here's the critical warning for this category. If your resting heart rate suddenly jumps above 85 without clear cause like stress, illness, or medication changes, or if you develop new symptoms like chest discomfort, pronounced shortness of breath, or extreme fatigue, seek medical evaluation within 24 to 48 hours. This could indicate acute development of heart failure, atrial fibrillation, or other conditions requiring prompt treatment. Category 4. The high-risk senior heart rate, 85 to 100 beats per minute. Category 4 represents the high-risk range from 85 to 100 beats per minute at rest. This is where we start seeing significantly elevated cardiovascular risk and where most seniors need comprehensive medical evaluation and aggressive intervention. If your resting heart rate consistently measures in this range, if you feel your heart racing even at rest, if you experience frequent breathlessness during minimal exertion like walking across a room, if you have a history of heart disease, diabetes, or multiple cardiovascular risk factors, then your heart is working much harder than it should be and you're at substantially elevated risk for heart attack, stroke, and heart failure progression. The mechanism at this heart rate level indicates serious cardiovascular compromise. Your heart is beating 30,000 to 40,000 more times per day than someone with an optimal heart rate. This extra workload accelerates cardiac muscle fatigue, increases oxygen demand, raises blood pressure, and promotes atherosclerotic plaque formation in your coronary arteries. The elevated heart rate itself becomes a risk factor independent of other conditions. Research published in the European Heart Journal followed 90,000 people for 15 years and found that every 10-beat increase in resting heart rate above 70 increased mortality risk by 18%. Your heart rate in this range often reflects multiple compounding problems. Uncontrolled or undertreated heart failure causes your heart to beat faster, trying to maintain adequate circulation despite weakened pumping. Undiagnosed or poorly controlled thyroid dysfunction, specifically hyperthyroidism, dramatically elevates heart rate and mimics cardiac disease. Chronic anemia forces your heart to beat faster to deliver adequate oxygen despite reduced oxygen carrying capacity of your blood. Sleep apnea causes repeated drops in blood oxygen during sleep, triggering compensatory heart rate increases. Chronic pain keeps your stress hormones elevated, driving heart rate higher around the clock. The intervention protocol for this category demands immediate action on multiple fronts. Schedule a comprehensive cardiovascular evaluation within 1 week, including complete blood work assessing thyroid function, anemia, electrolytes, and cardiac biomarkers. Get an electrocardiogram to check for atrial fibrillation, heart block, or other rhythm disturbances. Consider an echocardiogram to assess your heart's pumping function and valve health. Review every medication you take because beta blockers, calcium channel blockers, or other rate-controlling medications may need adjustment. Simultaneously, implement lifestyle interventions aggressively. Reduce sodium intake to less than 1,500 milligrams daily because excess sodium directly increases blood pressure and heart workload. Eliminate caffeine completely for at least 4 weeks to determine if it's contributing to your elevated rate. Reduce alcohol to no more than 1 drink per day for women or 2 for men because alcohol can trigger heart rate elevation and rhythm disturbances. Improve sleep quality by maintaining consistent sleep-wake times, creating a dark, cool bedroom environment, and addressing sleep apnea if present. The supplement protocol for this category includes hawthorn berry extract 900 milligrams daily, divided into 2 doses. Hawthorn has been used in European medicine for decades to support cardiac function and reduce heart rate in heart failure patients. Multiple clinical trials show it improves exercise tolerance and reduces symptoms. You need a standardized extract containing 8 to 2% flavonoids, and 18 to 20% procyanidins. The brand I recommend is Nature's Way Hawthorn Extract. Take 450 milligrams with breakfast and 450 milligrams with dinner. Do not take Hawthorn if you're on digoxin or other cardiac glycosides without physician supervision because it can potentiate their effects. Most people see modest reductions in resting heart rate of 5 to 8 beats per minute within 6 to 8 weeks. Here's what's critical to understand about this category. A consistently elevated resting heart rate above 85 is not just a symptom. It's an independent risk factor that increases your mortality risk, even after controlling for all other cardiac risk factors. Bringing your heart rate down through medical treatment and lifestyle intervention directly reduces your risk of heart attack, stroke, and sudden cardiac death. If your resting heart rate is above 90, if it feels irregular or skips beats, if you experience chest pressure or pain, if you develop sudden severe shortness of breath, or if you feel dizzy or faint, call 911 immediately. These symptoms combined with high heart rate could indicate acute heart failure, myocardial infarction, or dangerous arrhythmias requiring emergency treatment. Category 5. The dangerous bradycardia. Senior heart rate, below 55 beats per minute. The 5th category represents the other end of the spectrum, dangerous bradycardia, defined as a resting heart rate below 55 beats per minute in seniors who are not highly athletic. If your resting heart rate consistently measures below 55, if you're not a conditioned athlete with years of endurance training, if you experience fatigue, dizziness, confusion, or fainting episodes, if you're taking multiple cardiac medications, including beta blockers or calcium channel blockers, then your heart rate is too slow to maintain adequate blood flow to your brain and vital organs. The mechanism of pathological bradycardia involves either excessive medication effect or deterioration of your heart's electrical conduction system. The sinoatrial node, your heart's natural pacemaker, can degenerate with age. The atrioventricular node that conducts electrical signals from your atria to your ventricles can develop blockages. These electrical system failures cause your heart to beat too slowly to maintain normal cardiac output. Alternatively, excessive dosing of beta blockers like metoprolol or atenolol, calcium channel blockers like diltiazem or verapamil, or digoxin can slow your heart rate below safe levels. The critical distinction is between athletic bradycardia, where a slow heart rate indicates superior fitness, and pathological bradycardia, where a slow heart rate indicates disease. Athletic bradycardia occurs in highly conditioned individuals with no symptoms and excellent exercise capacity. Pathological bradycardia causes symptoms including fatigue, exercise intolerance, dizziness, confusion, and syncope. The intervention protocol depends entirely on the cause. If you're taking heart rate lowering medications, your physician needs to evaluate whether your dose is excessive or whether you need to switch to alternative medications. Do not stop these medications on your own because abrupt discontinuation can trigger dangerous rebound effects including heart attack or stroke. If medication adjustment doesn't resolve the bradycardia, or if you're not on rate-lowering medications, you need electrophysiology evaluation to determine if you have heart block or sinus node dysfunction requiring pacemaker implantation. Here's the emergency warning for this category. If your heart rate drops below 45 beats per minute, if you experience fainting or near fainting, if you develop confusion or altered mental status, if you have chest pain, or if you feel severely short of breath, call 911 immediately. Severe bradycardia can cause inadequate blood flow to your brain, leading to falls, strokes, or cardiac arrest. This is a medical emergency requiring immediate hospitalization and monitoring. Let me address a dangerous myth that circulates among seniors. Some people think that a lower heart rate is always better and that they should try to get their resting heart rate as low as possible. This is completely wrong and potentially deadly. While a lower heart rate within the optimal range indicates good cardiovascular conditioning, an excessively low heart rate in someone who isn't a trained athlete indicates serious cardiac or medication problems. The goal is not the lowest possible heart rate. The goal is the optimal heart rate for your specific fitness level, medical conditions, and medications. Trying to lower your heart rate below what's appropriate for you through excessive medication or extreme dietary restriction can cause life-threatening complications. Now let me give you another diagnostic assessment you can perform. This is called the heart rate recovery test, and it measures how quickly your heart rate decreases after exercise. Walk briskly for exactly 6 minutes at a pace that makes conversation slightly difficult but not impossible. Immediately after stopping, sit down and check your pulse. Wait exactly 2 minutes and check your pulse again. Calculate the difference. Your heart rate should decrease by at least 20 beats in the first 2 minutes after stopping exercise. If it decreases by less than 12 beats, this indicates poor cardiovascular fitness and elevated cardiac risk. This simple test predicts your mortality risk as strongly as cholesterol levels or blood pressure measurements. Let me tell you about Margaret, 71, who came to see me because her primary care doctor told her that her resting heart rate of 92 was fine for her age. Margaret felt tired all the time and couldn't climb stairs without becoming breathless. Her doctor had attributed these symptoms to normal aging. When I evaluated her, I found she had undiagnosed subclinical hyperthyroidism, where her thyroid was slightly overactive. She also had sleep apnea that was disrupting her sleep and causing repeated heart rate spikes throughout the night. We treated her thyroid condition, fitted her with a CPAP machine for sleep apnea, started her on a structured exercise program, and optimized her blood pressure medications. Within 3 months, her resting heart rate dropped to 68. Her energy returned. She could climb stairs again without breathlessness. Her elevated heart rate wasn't normal aging. It was a cluster of fixable problems that her previous doctor had dismissed. Let me tell you about Robert, 68, whose resting heart rate was 58 on multiple cardiac medications, including a high-dose beta blocker. His cardiologist thought this was perfect, but Robert felt exhausted constantly, experienced dizzy spells when standing, and had stopped his daily walks because he felt too weak. When we evaluated him, we found his heart rate was dropping to the low 40s during sleep, causing inadequate blood flow to his brain. We reduced his beta blocker dose, switched one of his other blood pressure medications to a type that doesn't slow heart rate, and within 2 weeks, his resting heart rate increased to 64. His energy came back completely. The dizzy spells resolved. He resumed his walks and felt better than he had in 2 years. His heart rate was too low, causing symptoms his previous doctor had attributed to depression. Now I want to address common concerns about implementing these protocols. Some of you are thinking, what if I can't exercise because of arthritis or other mobility limitations? This is a valid concern and requires adaptation. Cardiovascular conditioning doesn't require high-impact exercise or heavy exertion. Aquatic exercise in a heated pool provides excellent cardiovascular benefits with minimal joint stress. Recumbent stationary cycling allows cardiovascular exercise while supporting your joints. Even seated exercises, arm ergometry, or chair-based movement programs can improve cardiovascular fitness. The key is consistent, moderate effort that elevates your heart rate, not the specific type of exercise. Work with a physical therapist to develop an exercise program appropriate for your mobility level. What if you're already taking multiple medications for blood pressure, diabetes, and cholesterol? Won't supplements interact dangerously? This requires careful management, but is absolutely possible. Coenzyme Q10 has no significant interactions with standard cardiovascular medications and often helps reduce statin side effects. Magnesium can interact with certain antibiotics and bisphosphonates, but is safe with most cardiac drugs. Hawthorne can potentiate digoxin, but is safe with most other cardiac medications. Always inform your physician and pharmacist about every supplement you take and start new supplements one at a time so you can monitor for any unexpected effects.